There are a number of ways whereby HIV can penetrate through blood vessels to reach its target population. It shows two different entities, both HIV and its main target cell, which is the CD4 lymphocyte. The virus has an outer layer, and the outer layer, as you see, contains a number of spikes. These spikes include the major glycoproteins of the virus that are responsible for direct interaction with the cell surface. You can also see the matrix core, which exists in the symmetrical shape of an icosahedron. You can see that structure of HIV is very, very complex.
They will be discussing on the issue that is our sub-podcast topic. It will be on HIV and AIDS pandemic issues. So feel free, interact with us through social media, and just we'll get your feedback at the end of our discussion. That is it. So welcome, feel free. That is it. Welcome.
Yeah.
Honored to host some guests in studio. Yeah, I am with my co-host.
Okay, hello everyone, and I'm Jay Bless. Today I'll be the co-host, and let me give chance to our guests so that they may tell us their name, so that we may get to know about them.
Okay, my name is Immaculate Odiam.
I'm Cynthia Chamano. Yes.
Welcome. Feel free. Yeah, feel free in our studio. Yeah. So, as you are all aware, that today we'll be discussing on the health issue, health pandemic issue. Yeah, that's been a disease that it is it is a disease that is killing people silently. Yeah, people are assuming that it is people who have the HIV, they believe that someone can live with it for a long time without dying, but it is killing people silently. So today we'll be discussing on that issue of we'll be discussing on the effects of HIV and AIDS to those who are affected, and of course the preventions. So hope we are expecting a lot from you people. Yeah, that is it. So I will start with Cynthia. Cynthia Chamtai, right? Yeah. So can you just tell us a bit of can you just tell us what are the causes of HIV and AIDS mostly in Kenya? Yeah, we are focusing on our country, Kenya. What are the causes? The causes of this disease, this pandemic issue, HIV and AIDS. What are the causes of HIV and AIDS? The common causes. That is it.
Okay. HIV and AIDS is causes death.
The causes. What causes HIV and AIDS mostly here in Kenya? Yeah, mostly in Kenya. Causes of HIV and AIDS. Yeah. Like unprevented sex. That is it.
Okay. HIV, okay, first of all, HIV stands for Human Immune Deficiency Virus. And HIV can be caused in many ways. The first one, HIV can be caused through sexual intercourse, right? Whereby, let me say I'm HIV positive, and my partner is HIV negative. There's a possibility for us to there's possibility of one of us to be affected by HIV/AIDS. The second one, HIV/AIDS can be caused by the use of some object like razor blade.
Needles.
Exactly, needles,
Sharings.
sharings of handkerchiefs, let me say, things like that. Those are the ways in which HIV/AIDS can be caused by my.
Okay, I can add this. HIV can be caused through semen, vaginal fluid, and breastfeeding.
Okay, you've said something there, but majorly we have HIV that is caused by a virus.
Yeah.
It is caused by a virus in that it can spread through sexual contact, shooting of illicit drugs, or use of sharing needles that you said, and also and contact with infected blood. Then it can also spread from parents to child during pregnancy, like hiyo wakati wa
exactly.
kuzaliwa upate mtoto hajahandliwa vizuri, then utapata hiyo infection pia hapo kwa child at birth. Yeah.
So what about there is those misconception that there if you have there are these misconceptions that myths and misconceptions that the wave if you wave your hand with the if you are waving to the person who is HIV positive, you will just get HIV. Those misconceptions. Waving to someone who is HIV positive, can he or she infected with HIV? It's something. Who believe that one? Yeah.
Okay, that is just
It's
a
a
belief.
propaganda.
Okay, that is just a belief. In real sense, HIV and AIDS can't because haiwezi sababishwa na kwa kusalimia mtu, right?
Waving.
By kwa kuwave, kusalimia mtu,
Hugging.
hugging. No, that is not a way in which an HIV can be caused from one person to another. The simple ways that HIV can be caused from one person to another, we have mentioned them, but for that one, no.
So even there is another myth that if you being in staying with an infected person, someone who's HIV positive, in the same, staying with him or her in the same room, or sharing things. I can put it in a simple way that staying with a positive person who's HIV positive person, a HIV positive person in the same room or in the same house, and that cause that makes as someone who's HIV negative to just get infected with HIV and AIDS.
No, I can tell you this story about that I've experienced. When I found I was HIV positive, people stopped talking to me. Okay, some would even cannot touch me. Okay,
Stigmatization.
yeah, and I'm still here and I'm still living because I take a pill. Yeah, I take a pill every so yani inanisaidia sasa ina nguvu. Sasa si vile watu walikuwa kuniongelesha nini nikitake hiyo dawa sasa na prevent ku spread, siwezi tukaspread.
But you were living with people in the same room, or maybe
Yeah.
your siblings, your parents, your relatives, friends.
Naishi now.
Okay, I have a question. You said that you were being given some medications.
Yes.
So I can also say that the government, maybe say the United States or the United AIDS, are giving in special medications to these patients suffering from this kind of disease, that is HIV and AIDS. Probably they are giving them. We have the ARVs. So you said that while taking these ARVs, it means that it only reduces the pain and everything, but it cannot allow the transmission of diseases of this virus from one person to the other.
This ARVs, it keeps the virus undetectable.
Okay.
Okay. So you when did you realize that you were HIV positive? When you please tell us if it's not that private.
HIV virus nilizaliwa nayo. Sasa zile esteem yangu haitakuwa chini juu sasa nitaishi kama hao watu wote juu mimi nilizaliwa nayo. Sasa nafaa tu na take hiyo dawa sasa.
Okay, that is good. You said that HIV and AIDS you can get patients ambao kuna mwenye alizaliwa nayo the way you said, na kuna wale ambao wakati wa ku grow up due to some challenges. Unaweza pata wengine wanapata through accidents. Unapata they've been involved in accident. Yeah, exactly. So my question is that, or even my concern is that, what do you tell these people who are having HIV/AIDS that they are having this virus through they have it through birth, by birth, because unaweza pata kuna mwingine alizaliwa nayo. What can you tell these people ambao walizaliwa nayo before we go to those when walipata through accident or even through rape or the other things? Let us focus on this issue na wenye ambao walizaliwa nayo, because it's not their fault to be. Yeah. Yeah.
Naambia wenye walizaliwa nayo wasiloe their self-esteem.
Okay, my sister, you can tell us what's your take according to this issue.
Okay, for those people who are born with HIV and AIDS, my advice to them is like, wasikuwe that stigmatized. Let them just fall in the same class as those people who are not HIV positive. Yeah, let them not underrate themselves. Yeah, that is what I would like to advise them to do.
Oh.
Yeah.
So, Cynthia, so you have said you were born with the disease, right? So, I mean, how have you been, so far, how have you been progressing this, this infection? How have you been, how have you been, how have you been handling this disease so that it cannot affect you mentally, spiritually, there are those effects. So, how are you handling this disease so that it cannot affect you mentally, spiritually, and everything, such and stuff?
Okay, mimi kuna control. Sasa ile mimi huwa nataka hiyo dawa. Sasa ni ile siwezi eka mind yangu, siwezi eka mind yangu, si kitu yenye mimi nilitafuta mwenyewe. Sasa hiyo dawa na take, alafu hizo mashughuli zingine kama spiritually siwezi, yani.
Okay, can I ask a question? Doctor, a friend of mine told me the other day that these patients who are suffering from this disease, is it true that even after taking this medication, is it good to do some exercise? Like you do exercise, you eat balanced diet so that it may, someone who is suffering from HIV and AIDS can live even for, I don't know, let me say even 90 years. Yeah, na bado atakuwa tu na hiyo, hatakuwa na tatizo lolote. So is it true that even after taking this proper diet, doing this exercise, is it true that you patient atakuwa tu sawa ama? You can tell us.
Okay, it is true because this medicine, it has a lot of vitamin. It is combined with different diets, exactly. Vitamin is there, protein, carbohydrate, right? So what we need to do is just after taking the medicine, you need to eat a balanced diet, right? Then after taking a balanced diet, you have to do an exercise because this drug, if you take it, there is an energy. Energy. So you can't just stay with it without doing an exercise.
Okay.
Exactly.
Okay, so thank you for that. We have finished this part of watu ambao wamekuwa infected through even by birth. Let us now go to ambao wamekuwa infected through ajali. Let me say something like that. Ajali, because unaweza pata mtu amekuwa infected, walikuwa naenda tu safari vizuri tu, we can be na safari sisi sote hivi, then kufika mahali accident ifanyike,
So
mtu akatwe.
contact of body fluids.
Yeah.
So the HIV spread will be on our eye mode.
Yeah.
Okay, so
Yeah, you can tell us how this tunaweza waambia aje hao ambao walipata HIV and AIDS through accident.
not only, excuse me for that, not only accidents, also maybe through rape.
Okay, we are going to come through rape because rape is a different thing.
Yeah,
Okay.
exactly.
Yeah.
So finish that one first.
Okay, what I like to advise those people who got HIV through road accident
Mhm.
is that it was not because of their fault.
Okay.
It was by an accident.
Mhm.
So what I would like to advise them is that they just need to be they should not be stigmatized according to their condition.
Mhm.
You just have to cope up with people together, do things as usual. Yeah, exactly. That's what I would like to tell them.
My sister, what can you tell those kind of people so that we may get to know?
Okay, wenye walipata accident and
Yeah.
Yeah, exactly. Yeah.
okay, naweza waambia sasa, watu naweza waambia
Mhm.
yani wasikie wasisichukie,
Mhm.
watake hiyo drugs, watakuwa sawa, still wataishi.
Okay.
They should have the positive mindset always. That is it. So, I mean, can you just generalize your advice to the HIV patients worldwide or in Kenya? Just generalize your advice or generalize your that positive advice. Generalize your advice to those patients.
Okay.
Margaret.
The advice that I would like to give those people who are suffering from HIV/AIDS in Kenya or the outside world
Mhm.
is like this HIV, a person can survive with it up to 90 years. It depends. You can give birth to your children 4, 5 when you are HIV positive, but you can take care of them up to the old age. So what I'll advise those people who are suffering from HIV and AIDS to do is that they just cope up with the situation because already wako nayo. We can prevent, but we can't cure, right? So what I would like to tell them is that they just cope up with the situation. They take a balanced diet, right?
Exercise.
Exactly. Then they have positive mindset.
Mhm.
Exactly. They have positive mindset, and all shall be well.
Okay, let us now go to this. This is the main thing now.
Yeah.
We have the Gen Zs, right?
Exactly.
Okay, here comes a case whereby now we get HIV through, we have rape, and also kuna wengine unaweza pata it's like wanajitakia in that unapata they have the smooth conversation. Unapata boy ambie girl, okay, today can you come so that we may blah 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 and that atakuwa ana agree, yes, but now atakuwa anajua huyu jamaa ako aje. Then abruptly after 3 to 4 days hapo akienda kupimwa anapata kuna venye. So according to you, our guests here, number one, can you tell us what to tell our Gen Zs outside there? What to tell our Gen Zs in that, how should they take this before we come into agreement? What should they must know ya kwanza before waingie katika hii uhusiano ya
Okay, what I would like to tell Gen Z
Mhm.
is that first of all,
Mhm.
there are some Gen Zs, right, who are born with HIV and AIDS, and there are some people who are not born with HIV and AIDS. So what I will tell Gen Zs
Mhm.
is that they should abstain
Okay.
because there's nobody who died because of sex.
Are you sure that the disease will abstain from sex?
What I should advise them to do is that they should abstain from sex. This is because there's nobody who has died because of sex.
Or they they just prevent, Yeah, so use
The
the
preventive
protections.
measures and
Or if it's a mass that are doing it, they're doing sex, they should use protective such as condom if it is possible. But I myself, what I would like to advise them is to abstain because there's nobody who has died of.
According to that point of yours that you're saying they should abstain. Abstain is used. Let me say to this age from the teenage from 13 to 18.
Exactly.
Because someone when you're 20 or even 23, hautakuwa unamwambia baada abstain because their mindset is always changing according to how una grow. Unapata?
Okay.
Yeah.
So,
Mhm.
okay, by the way, what I would like to advise them, most of those people of age 20, 21 to 25
Mhm.
going onward,
Mhm.
is that if it's a must that they should do the sex,
Mhm.
they should use protective.
Okay.
Yeah, they should. Condom.
I mean, there is even a story in a university. So there is this guy. He revealed in herself that she has been and having sex with university boys, freshers, and of course the continuous student boys, male students. So she is HIV positive. So she was revealing that she has at least infected 70 plus male students in a certain university in Kenya. I can't mention that. So she was saying that she has infected 70 plus male students with this disease. I mean, something very sad, something very dangerous. At the same time, it is something very, something of concern. Yeah? I mean, she revealed herself. So don't don't you think that in this institution there is the spread of HIV and AIDS is in high mode? Can you just tell us about in our institutions, especially in universities, colleges?
Okay.
The spread of HIV and AIDS can be in high mode, according to that story of that student, a certain university. Can you tell us about that?
Okay, the spread of HIV and AIDS, most so especially in colleges or university or any other institution, is on the high mode. This is because, let me say, as a lady, I'm engaged in a relationship with somebody who is HIV positive, and at the back of my mind, I don't know that this person is HIV positive. And because of let me say, as a lady now, let me say, I'm carried away by peer pressure, right?
Yeah.
Like, I just want
Of
to do
having
this.
a boyfriend, like
Let
you
me
are fellow friends.
exactly. I want to do this because I see leader is doing this one and this one, and I see leader has a boyfriend. Me, I'm also fighting to have a boyfriend.
Yeah.
And let me say, nimepata boyfriend, and in hatujuani, don't know each other's status. I just know I just love the man, but I don't know he is HIV positive. This one can, when I'm engaged with him, I can contact HIV positive. This is because I don't know his status, he don't know my status. So what I would like to advise the university or college or any other institution student is that they should be careful with whatever they are doing. They should consider whatever they are doing. They are doing it at what time, with what reason, and for why, and with who, so that at least they can prevent some situations.
They should just, they should say no to
Yeah, they should
unprevented.
learn as a lady. As a lady, they should learn. As a lady, you should learn to say no or yes. And if you say no, mean no. If you say yes, mean yes. That is
Why should you say yes or no? You should be having a meaningful reason in your mind for saying yes or no to those actions, or of having a boyfriend, sex, and everything such and stuff. So
okay.
that is it. Cynthia, you have anything on that? So so here in Kenya now, Kenya, our country now, they are saying that the number of people who are having who are infected with this disease is about 1.5 million. Yeah. So don't you? What should we do as a country to at least reduce this? It's a bigger percentage of people. It's a bigger number of people. 1.5 million people are infected with the disease.
Okay, what we should do as a country in Kenya, also in Kenya or the other countries, is that we should create public awareness.
Public awareness. What is it?
Alafu you kama mimi na wewe, you have the power to stop the virus.
Yeah. Tower power, summer power. That is it. So we are done with our. Thanks for your time. It's just been our pleasure to have you people here in our studio today. Just been our at least you have given your our viewers or audience you have educated them in one way or the other. I mean they have at least gotten the content from you people, and they have known how to cope up with the disease. They have known how to, prevent it. And they have known the causes of this disease. Hope the number would reduce from 1.5 million to zero. Yeah, or a small number. That is it. So viewers, we're done with our podcast. It has been our pleasure having you people as our viewers audience. So until next time, subscribe on our, if you want to just follow us on our WhatsApp YouTube channel. That is Health Iba Group. That is it. Follow us, like, and everything will be
Okay.
good.